Thank you for having me. Hi, I'm Dr. Burkhart. I'm a clinical psychologist and I'm in the Department of Pediatrics at Rainbow Babies and Children's Hospital. And tonight I'll be presenting on helping the child who struggles with impulsivity. And I work with children and families ages 2 all the way up through 21 for a variety of presenting concerns, including high functioning autism, anxiety disorders, ADHD, and other neurodevelopmental disorders as well. So the objectives for tonight, to identify examples of impulsivity and common comorbidities, and to identify behavioral strategies to assist with managing impulsivity in children. Broadly speaking, impulsivity is defined as acting without the forethought about the appropriateness or consequences of an action. By itself, impulsive behavior is not a disorder. For example, we would expect that younger children display more frequent behaviors without considering the consequences in comparison to older children. It becomes a disorder when there's a fast reaction without thinking, acting without thinking, and/or when there is a tendency to act with less thinking compared to others with similar knowledge and ability, and it becomes clinically impairing. In general, we think of 3 different aspects to impulsivity. So there's the motor aspect, so action without thinking, cognitive, quick cognitive decision making, and non-planning, so a decreased orientation toward future thinking. Examples of impulsivity include interrupting a discussion, blurting out answers, difficulty waiting one's turn, difficulty managing one's emotions, engaging in risky behaviors, rushing through tasks, and then acting aggressively. How we address impulsivity is largely dependent upon how we conceptualize the cause or the reason for the impulsive behavior. The first explanation for impulsivity that I have listed on this slide is behavioral disinhibition. So this could be a personality characteristic where a child makes a decision on a whim, or in its extreme form would be antisocial or rule-breaking behavior. Taking a biopsychosocial perspective, impulsivity may be a learned behavior that is formed within the family. So in some families, children are socialized to react immediately to get what they want. An example of this is getting a need met, so hoarding food or taking a toy. We generally think that anxiety has an inverse relationship with impulsivity. However, when anxiety is extreme, a person may act impulsively out of desperation. Desperation causes poor decision making. For example, for the person who worries about getting a good grade, he may cheat on a test without thinking about the chances of getting caught or the consequences. When someone has experienced a traumatic event, often we think of in the form of child maltreatment or abuse, the child may display emotional and behavioral dysregulation. And this is because of the stress response being constantly activated within the body. Prenatal alcohol and drug exposure causes damage in the brain, particularly related to decision making. And the last on this list is ADHD. So this disorder is most commonly associated with impulsivity. Certainly there is an overlap of signs and symptoms of autism spectrum disorder and ADHD. Impulsivity in the form of social interactions may be common. And in adolescents or young adults, personality disorders and eating disorders may also be associated with impulsivity. Because ADHD is the most common manifestation of impulsivity, I have the diagnostic criteria of ADHD on this slide. So these symptoms must be disruptive and inappropriate for the person's developmental level. The signs of hyperactivity, impulsivity included in the diagnostic criteria are fidgeting, squirming, leaving the seat in situations where the expectation is to stay seated, running or climbing about in situations in which it is inappropriate, unable to play or take part in leisure activities quietly, on the go, talking excessively, blurting out an answer, interrupting or intruding, and having trouble waiting one's turn. These symptoms need to be present at least for the last 6 months and in at least 2 settings. The frontal lobe is involved with personality, emotions, and motor behavior. More specifically, the frontal lobe is involved in abstract thought processes, behavior, speech, attention, intellect, reflection, initiation, and even coordination of movement. The frontal lobe is not fully developed until the mid-20s, and it's the functioning of the frontal lobe that is most often implicated in ADHD. In general, we think of the following stages as representing how impulsive behavior is experienced and displayed. For example, there may be the urge to blurt out in the classroom or to take a toy that's not the child's. There's brief tension about engaging in the action itself. So in this example, blurting out the answer in the classroom or taking the toy. There's relief that they got what they wanted, and then the guilt sets in because they realize that they broke the rules. But remember, for some children, this whole process can happen within seconds. So I often get the question, so what can parents do? So that's what we're going to address now. Whenever there is an externalizing behavior, therapies typically begin with checking in on or strengthening the parent-child relationship. Based on this type of intervention, this can take the form of a 5-minute or 10-minute special time. This looks like individual playtime with the child, engaging in a creative activity like drawing or building blocks, or a free play activity like throwing a ball. This should be a purely positive time when the child is leading the play. There's no competitions. We stay away from questions, criticisms, and commands. The reason we start this is because when there has been externalizing behavior, the relationship may have been negatively impacted and there's a need to repair. And this also increases motivation to follow directives. The second step is establishing between 3 to 5 household rules and a daily routine. This helps establish consistency and structure. We want children to know what's expected of them. And when expectations are set, this actually serves to decrease anxiety. When children are impulsive, we also need to slow down the pace. The calmer the household can be, the less likely you'll see as severe of impulsivity. We often match the energy level of others and even the feel of our environment. Therefore, we need to focus on one activity at a time and work on just being in that moment before switching to another activity. And it's helpful to have the environment free of clutter. We also want to use lots of specific praise. Praise the child when you see him display the targeted behavior. Maybe the targeted behavior is when he shares or asks before he takes something. We are motivated to please and to get attention. This is a great way to get the attention that children so often desire. With children who are struggling with displaying the targeted behavior, we sometimes need to praise the positive opposite. For example, for the child that runs and climbs, she doesn't do that all the time. So anytime there are a few walking steps, you praise this right away. If the child is walking and then it looks like she is going to run, then you praise the positive opposite. I love when you use your walking feet. We also want to work with children on building their emotions vocabulary. We may begin with happy, sad, and mad, and then include worry or scared. You begin with working with your child on I feel statements. For example, I feel happy, sad, mad, or worried because of blank, and then identify the reason why. The goal is to have children to be able to match emotions with specific situations. You can then begin to work with your child on identifying warning situations. Warning situations may be having to transition off of video games or doing math homework. When warning situations are identified, we can then use prevention strategies or coping skills to decrease intense emotions. As I said, it is best to use praise statements as often as possible. Examples of praise statements include, great job keeping your hands to yourself. I love how you're using calm and kind hands. You're coloring so neatly. Nice work. Good work reading quietly. Great job listening and waiting your turn. I'm so proud of you for taking your time to complete your homework. In order for parents to work with a behavior specialist on creating a behavioral plan, we first want to understand the function or the purpose of problematic behaviors. In some situations, we don't need to use a reinforcement plan or give a consequence in order to see a different behavior. It may be that just by making environmental modifications that the behavior declines or extinguishes. The most common reasons for problematic behaviors include wanting to escape or avoid a situation, to get attention, have a need met, attain something that is reinforcing, and or to manage sensory sensitivity. A chart like this might be used to better understand the ABCs, or in other words, the antecedent, so what directly precedes the problematic behavior, the targeted behavior, and then the consequences, which means how you respond and then how the child responds may actually end up reinforcing the problematic behavior. For example, if a child keeps poking at his brother and gets attention from both you and the brother, even if it's negative attention, this may continue. Therefore, if you give positive attention and praise the positive opposite, kind hands or hands to self, then the problematic behavior would likely decrease. This takes some time, however. An example of an environmental modification that is relatively easy to implement is to avoid going on errands for an extended period of time. You can build up to longer periods of time, but first start with one place for a short period of time to help the child have a successful experience regulating emotions and behaviors. Another way to help children manage impulsivity is by giving effective commands. Present the command as a statement rather than a question. For example, you need to hold my hand when we're in the parking lot. Another effective tool is to use first then commands. First, you finish your homework, then you can go outside and play. State what to do rather than what not to do. Give one command at a time. Make sure you can follow through with the directives or the commands that you're giving. Minimize distractions when giving the command, and externalize time by using a visual timer or even an app. Use do commands or positive instructions. Give warnings of transitions when possible, and limit use of stop and no commands. When we want a positive behavior to increase, we want to use reinforcement. We want to break down the behavior into small steps or the day into chunks to allow the child to be successful. For example, for a child who can't stay seated, it is unreasonable to only give a reward if a child stays seated at all the designated periods of time during the day. So we break down the day into smaller pieces. To reinforce behavior, you can use praise statements, spontaneous rewards, a formal reward system where so many points are earned to receive a small prize or something tangible, and then even a token economy where points are earned and then taken away. So this is an example of possible rewards that we refer to as a rewards menu. So this list includes both something that can be given immediately, like a sticker or a point, as well as larger rewards, and then no cost or low cost rewards. And certainly you have to factor in the behavior that you're looking for, the targeted behavior, as well as the child's age and what the child finds to be reinforcing when identifying what type of reward should be chosen. You want to ignore minor misbehavior when children are engaging in that behavior just to get negative attention. An example of this could be whining or blurting out. So ways to ignore minor misbehavior include avoiding eye contact, not touching the child, using a neutral facial expression when you're ignoring, not talking or responding to the child, being consistent about ignoring, and then returning your attention as soon as possible after the misbehavior stops, and then reward or praise whatever the next behavior is once the misbehavior has ended. So these are some examples of positive discipline strategies. So timeout can successfully be used for younger children for most cases. And we can also use time-limited removal of a privilege and or a natural or logical consequence. And what I mean by that is perhaps the child got mad when playing video games and then threw the controller and it broke. So the natural or logical consequence would be now the child doesn't have a controller and can no longer play. With regard to working with the child individually, in addition to building an emotions vocabulary, we also work with children on problem solving. So these are just two strategies for doing this. So you see on the left, there's the POTS strategy. So helping children to go through this acronym. So what is the problem? What are my options? Which option should I pick? And then evaluating the solution. So did I pick the right option or solution? And if you did, then we encourage self-praise. And if the correct option was not chosen, we encourage children to go back in and review the other options they could choose. And then the method on the right represents two different methods. So one is stop, relax, and think that we help children identify. So, warning situations in which they need to stop. What are some relaxation strategies that they can use, such as deep breathing? And then, how can they think about what's the helpful choice to make? And then also, another is stop, opt, and go. So, stop, consider the options, and then go. So, similar to a traffic light. As I stated in the beginning of this talk, depending upon how impulsivity is conceptualized and what comorbidities may be present, this is a list of empirically supported or evidence-based interventions that may be used. So we see here that parent training is the evidence-based intervention for children who have ADHD, oppositional defiant disorder, or if there's other externalizing behavioral problems. We use behavioral therapy in younger children, as well as children who are presenting with anxiety, autism spectrum disorder, ADHD, and also we consider social skills intervention to be under that umbrella of behavior therapy. And then cognitive behavioral therapy is an empirically supported intervention for anxiety and depression. And I provided this website, effectivechildtherapy.org, and that's affiliated with the American Psychological Association. So if you do have questions about which type of intervention your child should receive, or if your child is receiving the correct intervention based on diagnosis, this is a helpful website that provides that information.